Hi, this is Lord Cheek from Lornicopia. I'm in my kitchen because I just made dinner and I'm getting hungry. And my cat over here is stalking me. Yeah. Oh, Henderson. Anyway, so as you know, today I chimed in about 2 days before explaining what was going on with the coronavirus and then what it was. Well, today we have had a whistleblower in the United States that said that when they were bringing people back from the Diamond Princess cruises, that they were not given proper training and gear to not spread the coronavirus. And also, as you know, today we had the first case in the United States that was not associated with China or traveling abroad. So what that says to us is perhaps the virus did get out. As the travel ban was starting to happen, maybe it's surviving on surfaces, which viruses do. So the patient that got it might actually be infected because they bought something from China. But in good news about that, I was watching a video today where they were showing factories in China and stores and things like that, and they've used protective barriers around cashiers. People are wearing a lot of plastic covers, very ingenious ones, I might add, and they're sanitizing a lot of stuff using probably bleach and water, I would assume, but whatever. You could use, like I told you, vinegar, you could use bleach and water, you could use Lysol, and they could use what is the other one? Alcohol, which alcohol and vinegar are not toxic at all in any regular form. But anyway, so the other thing is the coronavirus actually reached Brazil. So what I'd like to address today is how concerned should we be about the coronavirus and what preparations should you take? Well, obviously you should wash your hands a lot. And as I said, if you have found out that you think that you're infected with coronavirus, go to a hospital and try to get tested. Unfortunately, what's happening, as we've seen today, is they'll send you to the hospital, and because you're not in that symptomatic group, and I'm sure that demographic will change, of having traveled to China or to Iran or or South Korea now, they would kind of delay your testing. That happened in the news today, but I'm sure that's going to drop. So we're making a lot of mistakes early on, which would be expected. The stock market is kind of warbling a little bit. It's the 26th of February. Yes, and the stock market took a hit. That's naturally going to happen. But the reality is, what's going to happen with this virus is it's going to kill some people. Mostly it seems like people with compromised immune systems. We don't know how it's going to react. We're trusting the results and data that are coming out of China. And we have to assume that they're forthright. If they are not forthright, we will see different death tolls, etc., in South Korea and Italy. And that will happen in about 4 weeks. We'll start to see that changing. And either it is as China says it is, and the recovery rate is much larger, and the death rate is impacting not children, not young people, but old people, people with pre-existing conditions, other health compromises, which would be ideal. That's still going to kill a lot of people, if they get it. But what we'll probably see with the coronavirus is you'll probably see this first initial wave, which is sweeping all over the world. You will begin to see percolating groups of outbreaks that will exponentially grow in numbers, and those will be your infections. And then you will have a recovery rate and a death toll. Is life as we know it going to come to a halt? No, it's not. What's going to happen is if it enters your city, and you have an outbreak in your city, it's going to slow a lot of things down and compromise things. But we'll have to basically sanitize what we're shipping. You'll have to be careful if you have an outbreak in your city that gets out into the public, and you'll have to wash your hands a lot, and also try to self-quarantine if you feel sick. and go to the hospital and get treatment. So we'll see in about 4 weeks. I'm watching it every day. The way the coronavirus is responding in South Korea and in Italy is very, very similar to how it is reported to have happened in Wuhan and those provinces right around it in China. So you can expect a possibility of somewhere around 70,000 infections in those countries, is what I would assume based upon the data that we already have. But with a death rate of about 2%. So that's our update right now. Should you be paranoid? And I'm like still going out to bars and going out to restaurants because it's not here and it's not in that way yet. If it were, it would be on lockdown. I'd be kind of like temporarily out of a job because I work as a waiter and people aren't going to go out to restaurants and movie theaters or church or anywhere else. It's going to give us a ding, but we'll be all right if we take the right precautions. And that's really the big thing, is being ready for it when it gets here. We are still about 5.5 weeks out from them potentially having a vaccine for this, and we don't even know if that will work. But the numbers from Italy and South Korea who have been infected and are exponentially growing, just like they did in China, are going to tell us over the next couple of weeks and elsewhere in the world, if they pop up, what the pace of this virus is going to be. So that's my update. Lauren Cheek from Lornicopia.